Hello, my name is Ray DiGiuseppe, Director of Professional Education at the Albert Ellis Institute and Professor of Psychology at St. John's University. Welcome to one of our Master Therapist series. In these tapes, we will be showing live sessions of master therapists doing rational emotive behavior therapy. We have found over the years that therapists learn much more from watching a therapy session and modeling the behavior of the therapist rather than just watching workshops and reading books. Many trainees who watch therapy tapes want to know why the therapist made some of the decisions that they've done. They almost would like to get inside the therapist's head and think and listen to the conversations about why choose one intervention over the other. To help facilitate learning how to do therapy, we're going to have conversations with the therapist after each therapy session where we watch the therapy session and at key decision points ask each therapist why they made the decision that they did. Then the observer can see not only what the therapist did, but the ideas and the feedback and the information that they used in making those clinical decisions.
Two things strike me about the tape here. One is you really disclose a lot about yourself, your own sugaraholic problems with diabetes, and your mother, and her eating behavior. How typical is this for you to self-disclose this early in a session?
Very typical, because I feel, and I may be wrong about this, that if I reveal myself, speak my language, which is very down to earth, and tell things about myself, they are much more likely to feel free to open up and talk about themselves. So that's very typical. I did it before I started rational emotive behavior therapy, and I consistently do it with many of my clients much of the time.
Okay, now another thing about this client, you ask him to focus or how he doesn't focus on the negative consequences of his drug use, and he immediately goes off and talks about his father, talks about his past. Do you think he's really motivated to change his drug use, and he really sees the drug use as a negative thing?
No. I'm going to try to help him do that. And incidentally, I take advantage of that because I say to myself at this point, now look, he's not going to listen to giving this up. He's resistant on that point, as you sort of saying, Ray, he really wants to go on. But if I show him some rational emotive behavior therapy about somebody else, like his father, it's once removed. So the point I'm going to try to get over is that he has low frustration tolerance in telling himself that he can stand not having it like his father did. Now, if I explain to him what his father did, then it's once removed from him, and he's likely to get the point better.
But you're aware that he's not totally motivated, and he still has some denial of the negative consequences of his addiction, and you have that in your back of your head, and you're using this opportunity to teach him the ABCs of RET in a less threatening situation.